Let's talk about 5 things that are not true about critical care. One of those things which I hear the most, and is probably one of the reasons why new grads say they want to come to critical care all the time, is because we only have 2 patients. How hard could it be? I'll let critical care nurses answer that one in the comments. But I will say one thing for sure: you can never put me in med surg. And that's not a bad thing. Hats off to med surg nurses, because I could never. Y'all are just a different breed. It takes a special person to be a med surg nurse, just to put that out there. The second thing is the doctors tell us what to do. No. As a critical care nurse, our brains are always turned on and running. We're running everything through our heads all the time. We just don't think about what's wrong with the patient. So say we have a patient come in and they're there. For instance, patients that I take care of a lot, especially in the neuro ICU, I deal a lot with stroke patients. But anything can happen whether you're in the hospital. Not only that, a lot of them end up with GI bleeds. Their body just can't take all the stress that's going on. And even though we're giving them medications to hopefully help with ulcers, it's just not true. It doesn't stop everything that's happening. But you can't just think of one thing. So even though they're there for a stroke and it's dealing with the brain, I still have all the other organs I need to worry about. But not only that, but just having to critically think through things. A lot of the things, especially in the neuro ICU, depends on my assessment. If I notice something wrong with my patient that I've been taking care of all day, that could be a huge indicator that something's going on with their brain that we just haven't caught yet. And sometimes that means me reaching out to the doctors and hopefully getting that CT scan to see if there actually is something going on with that patient or not. But a lot of the times, our doctors, yes, they give us orders to go by, but a lot of the times we're the ones that are with these patients and seeing active changes. And we're the ones that have to reach out and advocate for ourselves and our patients to get certain interventions that we may need that we just don't have a standing order for. I think the third thing is that every patient gets better. Not true, especially in critical care, you're dealing with the sickest patients. And we do have lots of good outcomes, but also there's just so many things that happen where a lot of these people sometimes just don't go back to living life the way that they did before. Especially working on the neuro floor, a lot of them have a lot of injuries and they have to learn how to live life in a different way. And sometimes it's sad to see that. We want our patients to get better and them to go back to that baseline, but sometimes that's just not reality. On top of that, dealing with some of the sickest patients and these brain injuries, a lot of them unfortunately succumb to their brain injuries. The fourth thing, which is that we are numb to death. I think that's kind of a complex way or a complex question, because in a way, yes, but in a way, no. So I will say some deaths may be easier than others, and that's just because I know that they are not in pain anymore and they're not suffering. But then also sometimes it's hard because you become so attached to these families and just seeing them go through that hurts you. And I know we shouldn't take things home, but sometimes it's hard. We do get attached to these patients and these families, and we're not numb to everything. And the fifth misconception is that machines keep patients alive. Yes, to a certain degree, but your medical team helps keep you alive too. Between the nurses, the respiratory therapists, even your PT, OT, speech, all of them are doing stuff to help get you back to where you need to be. And having us be bedside with you, sometimes even though those machines are keeping you alive, sometimes if we catch something that the machines won't catch, and that's going to be something that could possibly save you.